Hello, my name is Dennis Ledford. I'm one of the Associate Editors of the Journal of Allergy and Clinical Immunology, and we have with us today a well-known asthma investigator, Dr. Stan Szefler, who's going to talk to us about a recent article in the Journal of Allergy and Clinical Immunology. I'm at the University of South Florida in Tampa, Florida, and Dr. Szefler, I'll let you give your credentials because I think they've changed recently.
They have changed recently. Yes, I'm currently at the Children's Hospital of Colorado and at the University of Colorado Denver School of Medicine in Aurora, Colorado.
The article that we're going to discuss this morning has relationship to the treatment of asthma. I will let Dr. Szefler maybe start out by giving us the title and a little bit of the background of the paper, and then we'll get into some specific questions about the findings of the paper.
Yes, this article is published in the Journal of Allergy and Clinical Immunology, and the title is Incidence of Malignancy in Moderate to Severe Asthmatics Treated with or Without Omalizumab. And there was a panel of authors on this article who provided oversight during the study. This was a very important study because it was follow-up to a commitment that was made to evaluate the rate of malignancy with and without the treatment of anti-IgE or omalizumab. And it was conducted, each participant was asked to participate over a 5-year period. And it was not a randomized study, it was an observational study, and patients had to meet the criteria in terms of anti-IgE requirement. Some began the study on omalizumab, some did not have omalizumab, and given a 5-year period of time, some crossed over. Some started on omalizumab and stopped along the way, and others who were not on it began it. So it was kind of a real-world type of study with follow-up and monitoring very carefully for onset of cancer.
So a 5-year study, so these are difficult to do, these are long-term
Yes.
studies. So what are the findings, what were the outcome of the study that you would like to draw the listeners' attention to?
The major findings in the study, very detailed analysis was conducted, and there was no significant difference among the two populations in terms of the primary outcome, which was onset of primary malignancy. And there was also evaluation of non-malignancy type of cancer, and no difference in that population. And then the third finding was looking at various types of cancers to see if there was a signal with any specific type, and there didn't seem to be within those two populations.
I see, so it's not randomized, and it wasn't an efficacy study, but it was
Right.
to answer the question of malignancy risk with omalizumab.
Correct. Besides the cancer evaluation, there was evaluation for other safety features, and those will be analyzed and published in a separate article. This particular article just focuses on the question of malignancy, which was a signal in some of the past studies. There was about a 2-to-1 rate in the populations in terms of malignancy in some of the past controlled trials that were conducted. So this study was conducted as a long-term follow-up to see if that signal continued.
So will the findings of this study, recognizing it's not randomized, influence your decision on the use of omalizumab?
I think it did. Excuse me. It certainly makes me more comfortable in terms of recommending its use and using it in patients that I would follow. So it's reassuring information, and I think that's the important part, is that some of the initial findings for the medication were found in small studies, now conducted in larger studies, don't seem to bear out.
I see. So I guess in summary, we could say that this has answered a big question. I know you can't answer this, so I'll ask it anyway, because I know you always have a good answer for questions. Do you think the FDA will change the label, since there is a statement in the label that warns of malignancy risk with this medication?
I think that's a very good question. It's rarely does the FDA change a label that they've already committed to, but I think they have to look at the data themselves. This is the analysis that was conducted by the pharmaceutical firm with oversight by the investigators who are authors, and I'm quite sure the FDA will conduct their own analysis and see if they agree with the data and come out with their own conclusions. And then, and only then, will they change. I must say that these studies are very expensive to conduct. So once a company commits to a trial, it's a very huge investment. And it does bear looking at in terms of the larger population, the coverage over time. So I think these results need to be looked at very seriously and balanced with what other opinions people may have of the data. The data will be available for independent evaluation.
So I would encourage everyone to read the paper and make your own critique of the paper, because I do think we all have to make our individual decisions, and these are complicated long-term questions. So I guess as we wrap up, is there any sort of succinct message you'd like our listeners to know about this paper? If you had to summarize it in one sentence, what would you say?
I think as this paper becomes available to clinicians and it becomes available in the press, patients will ask about this. They're familiar with the past adverse effects, and they really need reassurance. And this paper, this publication, this data set is a source of reassurance for them in terms of looking at past statements that have been made about safety.
Dr. Szefler, thank you for sharing your time with us, and I hope this was of some value to you as you read the article in the Journal of Allergy and Clinical Immunology.